my name is Bruno Silva. I'm one of the dentists at the Brighton Implant Clinic and making a short video today about problem lower dentures. It's a common problem that people often come to our clinic for, and I thought I'd make this video just to outline that actually the solutions that are available are relatively quite straightforward. So I've got two examples here today to basically show what can be done. Anyone who's experienced or has a lower denture will know that it's quite difficult to keep in place, and they can be quite troublesome, especially when eating. Unlike natural teeth, what happens, a lower full denture has really nothing to essentially hold on to. So provided you have enough bone, the denture can be relatively stable and can keep in one place. But over time, as we lose bone, the denture needs to be replaced, and unfortunately starts to become a little bit uncomfortable as the bone changes but the denture stays the same shape. So this first example, this looks like a conventional denture on the outside, and essentially it is. But if we look a little bit closer, if we just remove the denture, we can see that there are two small attachments that are basically in this model just replicating what two implants would look like. The procedure to have this done is relatively straightforward. It can be carried out under local anesthetic or intravenous sedation. It takes about an hour and a half to 2 hours to do. The implants are placed into the bone, and we would do obviously all the necessary checks and examinations and pre-investigations to make sure that adequate amounts of bone are available. And then once the implants are in place, there are two small attachments that look like small little ball attachments, and we have the respective corresponding little attachments that fit inside the denture. So with as little as 2 implants, we can stabilize the denture. So there's a little click, and now the denture actually stays in place. So eating, speaking, we see that the denture no longer will move during those movements, during those tongue movements, and it can really improve someone's quality of life and essentially just great improvements in confidence and comfort. So this is an overdenture on 2 implants for the lower jaw. So the alternatives of having an overdenture, like I've just explained, whereby the denture fits onto 2 implants, is to actually have something fixed. So there are some variations obviously with overdentures and implants and with fixed teeth. But just to simplify, we're going to just show you those 2 examples again. So on the left side, I've explained to you how a overdenture works on 2 implants. The slightly improved or slightly more advanced version of this would actually be a fixed bridge on a minimum of 4 implants. So where this is slightly different to the overdenture is that this is actually fixed, it's not removable, and it's basically only amenable when to your implant dentist who's basically dealing with your treatment. So in this solution, we need a minimum of 4 implants, and the bridge itself is actually secured by means of 4 small screws. So you can see from a comfort point of view, it's a little bit smaller, and it doesn't have as much plastic or as much of a flange, which is what we call it, both on the inside and on the outside, so it's a little bit more comfortable. So this version would probably be something more similar to natural teeth when compared to having an overdenture. There are some limitations in having treatment like this. Obviously we need to consider again if there is sufficient amounts of bone and if the bone is suitable for having implant treatment. And both of these solutions would also require some ongoing maintenance, because unlike natural teeth, these teeth are slightly softer. They do undergo wear and tear, and just like with the denture and a bridge, over time they may need to be replaced. What we commonly see with a overdenture is that these little attachments that are clicking into place daily when the denture is removed for cleaning, those attachments sometimes need to be replaced. Usually we tell patients either 6 monthly or yearly. With a fixed bridge, this again also needs some maintenance. We at the clinic here at Brighton Implant Clinic, we recommend yearly appointments for removing the bridge and cleaning underneath to making sure that the implants are healthy. And in addition to that, over a period of 4 to 7 years, the teeth on the bridge may need to be replaced, or in some cases the bridge needs to be replaced completely, depending on what material it's made from. So you may be able to see other videos on our YouTube channel about patients that have had all on 4 or teeth on 4, as well as overdenture cases, and you may be able to get some more information about how the before and after has changed or improved on those patients' lives. So from a cost perspective, the overdenture solution is more affordable because there are less number of implants. With a bridge, the cost is a little bit higher because there are a greater number of implants, and the bridge itself is a more intricate, more complex prosthesis that needs to be made. If you are interested in either of these solutions, you may find other videos with facts about overdentures and bridges on our YouTube channel, and it is something that we do provide on a daily basis, and we do see the advantages to patients very, very frequently. So hopefully this will have helped you to give some insight as to the difference between having an overdenture on 2 implants and having fixed teeth that are probably as similar to natural teeth as one can get. So thank you very much.